Hi, my name is Dr. Mughal. I'm a GP since 2008. I've had various roles over the past 10, 12 years. I've worked in primary care settings, I've worked in GP settings, I've worked in community hospitals, I've worked in prison settings as well, in urgent care center, and recently I've taken up the challenge to bring all of my experience and to consolidate into helping people with the long COVID. So, what's the support available or the work which has been done in the Lincolnshire Long COVID is that the local CCG has funded, in association with the NHS England, the Long COVID clinic, and we have got the funding until next April. The long COVID clinic is a multidisciplinary team and which includes a host of other individuals which come together and work in very close association. So people who are in the long COVID clinic are two GPs. We have got several therapists, which include OTs, chest physicians, chest physiotherapist, people from chronic fatigue syndrome, people from mental health, people from speech and language disability. So, though these services are available individually and they can be accessed through primary care, which is the GPs, but they are all working under one umbrella so that we can. It's a one window shop, so the patient don't have to be referred individually. They come together. They are referred to the long COVID clinic. We assess them and then find the appropriate facility which will help them. It certainly helps from a clinical point of view that once we've identified individuals and ruled in or ruled out whether there was any medical condition or there is no medical condition, then rather than sending the patient to individually, there is just one person who contacts the individual and then they are then put into the appropriate category where we feel that they will be best supported. Statistics wise, I think since last year, April 2022, there have been just under 2 million people in England who were diagnosed with long COVID, and that accounts for about 2.8% of the UK population. Now, that in turn translates into 1 in 6 people who've had COVID may end up having long COVID. Symptoms of long COVID we come across are breathlessness, fatigue, chest pain, headaches. The list is endless, but these are the bulk of the symptoms that we see. Now, these symptoms are fairly big and are common in other diseases as well. Our role is to identify that the symptom that you are presenting with is pertaining to long COVID, not to other disease. And that is the reason that the MDT has got individuals from all different specialities under one hub or one umbrella so that we identify what is the main thing which is affecting you and then do and refer you appropriately. For example, if fatigue is your main problem, and as long as we have ruled out that there is no underlying other condition which is responsible for fatigue, then we provide self-help. We have got app, and then we have got we have got professionals, we've got peer group who we can signpost or refer you for support. Similarly, when it comes to breathlessness as the common symptoms of long COVID, what we have seen is that we want to make sure that it's not because of any underlying condition. For example, it's not asthma, and if there is a history of smoking, then it's not a COPD, or it's not because of a cardiac reason. And as long as we are happy and we're confident to a fair extent that it's not because of underlying condition, then we have got the professional respiratory physios there who can help and support you again, self-help, one-to-one physiotherapy to help with your symptoms. So fatigue in a long COVID is has a huge spectrum. This can be mild, moderate, severe. And It can be a new symptoms as a result of a long COVID, or it can also trigger a pre-existing condition, for example, chronic fatigue or fibromyalgia. Or if a person has got any underlying rheumatological condition, for example, rheumatoid arthritis, or they've got inflammatory arthritis, it can make it worse. Again, depending upon the symptoms, yes, we do identify and categorize the individual to what extent the fatigue is affecting them. Is it affecting them at home? Is it affecting them at work? Is it causing functional disability? And then direct them according to the appropriate services of the chronic fatigue.
The challenges that individuals are facing in Lincolnshire post-COVID is the uncertainty about the symptoms. Because post-COVID, there are plethora of symptoms, and it's sometimes very challenging for an individual to identify that whether are there symptoms related to post-COVID or are they because of any other condition. The common symptoms of long COVID are fatigue is the topmost, followed by breathlessness, cough, and then there are mental health symptoms like brain fog, anxiety, depression. So the challenges that we as a clinician face is almost similar to what an individual is facing. So, for example, if an individual is coming to us with the symptoms of fatigue, we would like to make sure that there are no other underlying conditions that can also present as fatigue or cough. The way how we approach this is that there are a couple of GPs in the MDTs, and there is a whole lot of all other clinicians. We've got OTs, physiotherapists, speech and language, respiratory, and people from chronic fatigue. So there are several individuals focusing on one symptom, and everybody will give it their own feedback and tend to identify whether does the symptom qualify for the post-COVID diagnosis, or is there a possibility of any other underlying condition. Individuals who have already got an established long-term conditions, for example, they've got established heart disease, established lung disease like asthma, COPD, or any inflammatory long-term conditions like rheumatoid arthritis or any autoimmune disease. Unfortunately, on those individuals, their autoimmune system is constantly working. So it's always constantly challenged, and COVID also challenges the immune system. So in these individuals, it can be even more challenging for us to identify and to separate between whether it was an exacerbation of their pre-existing condition or is it a long COVID symptoms. And in practice, what we have identified that there is no clear picture. It's always an element of both an exacerbation of pre-existing conditions made worse by the long COVID.
The opportunities available which I have seen is one good thing which the Lincolnshire CCG or LCHS which has done is the excellent campaign of the COVID vaccine, and we are now reaping the benefits, and we can practically see in our long COVID clinics the incidence or the complexity of individuals is slightly improving, and the evidence now shows that if the individual has had 2 full doses of the COVID vaccine, it doesn't matter if they've already been diagnosed with the long COVID, as long as you've had 2 COVID vaccines, which the Lincolnshire Healthcare was really on top of it, then the evidence is that it will definitely reduce the incidence of becoming the problem as a long COVID or becoming the issue for more than what is needed. So and my anecdotal experience is that the long COVID normally lasts for about 6 months to almost 2 years. but people who've had the vaccine are seeing a bit shorter duration. It doesn't mean that everybody is going to fall into that black and white category. There are going to be some individuals going to be a little bit longer, but overall, I think the vaccination campaign has been excellent, and now everybody is seeing a benefit. The importance of maintaining a healthy lifestyle has never been so important until COVID. And we have, like I said before, a resilient body, a healthy mind, people who look after their psychological health, who look after the body, who exercise, who don't smoke, really have got a high resilience, and they do a lot better as compared to individuals that we have come across, or they may face the challenges. So we know giving up smoking is not easy. We understand that. And there are One Health is available to help people, individuals stop smoking, but then it's going to take time. And that sometimes it itself can become frustrating. That can lead to other diagnoses, like, for example, COPD, bronchiectasis, fibrosis, so many things which can complicate matter. So, leading a healthy lifestyle is vital. Pace yourself, take your time off. Um, if you're struggling at work, speak to employers. So many employers are also on board with long COVID as well. Have a good diet, good sleep pattern, eat healthy, alcohol according to the national guidance limit, and that is really, really the key message here. The current evidence is that if one has got an acute COVID or acute illness, then it is recommended that you take at least a week or two, depending upon certain factors, your age, your gender, and other medical conditions, and allow a bit of time to recover, and then you can gradually start. The magical word here is to pace yourself as much as your body is allowing you to do. Take it gradually. In the post-COVID clinic, sometimes we have seen individuals who were very active, very sharp, and they would like to go back to their pre-COVID levels. And sometimes that does more harm. So do it gradually, do whatever your body is saying. Our body has got its own language, and sometimes we just have to listen to it. Listen to your body, take your time, it will get better, it will recover. And it's just a matter of time before you can go back to your activity before COVID. With the children, there aren't many cases that come through us because the incidence of long COVID in children is pretty low. That's very good. Nonetheless, fatigue is the main issue if the children do come across. And if they need any further support, there are plenty of websites available as well that children can tap or engage into. But if they need a bit more one-to-one care, a bit more specialized, then the Leicester is the hub. I think the trajectory of long term is still unfortunately remains unknown. But like I said, the evidence, if you look at the evidence so far, as once an individual has had the vaccine, then the likelihood is that it's very unlikely that they're gonna end up in a long-term situation or long-term problem. So it's positive. Like with any other illness, I think the individuals general attitude towards health plays a vital role. So going back to the basic, a healthy mind and a healthy body is going to be far more resilient to the long-term changes as compared to if there is a history of smoking, drinking above the national limit, or if you're not exercising according to the WHO guidance. So as long as there is a baseline healthy body and you've had the vaccination, generally I would say 6 months to 12 to 6 months to 2 years is an average time where people do recover. And finally, I would say that we have an MDT every week. We do refer individuals for rehab. Only a very minority of the individuals do come back to the clinic that they have not made a progress. And I think that in itself is a very good evidence that there is a light at the end of the tunnel. Certainly, there is a lot of hope for individuals, people suffering from the long COVID clinic. At the Lincolnshire long COVID service is an excellent service available. What we offer in the long COVID clinic is that we listen, we acknowledge, and then in our MDT, we validate your concerns. We know that post-COVID symptoms are very vague. It needs a plethora of symptoms, and there are so many signs that there can be. There is no one pattern to it, but it does not mean that if one is feeling fatigue, it does not exist. It's all in the mind. We do understand, we do listen, we acknowledge, and we are there to help and support you. GPs are here to make sure that individuals who got perhaps may have an underlying condition which may mimic long COVID, we are there to help that those individuals do not get past us, or we are there as a gatekeeper or as a filter. For example, given an example, a young person who's feeling fatigue, we want to make sure that they are not anemic, they don't have celiac, or individual hasn't got any underlying thyroid disease. Similarly, as compared to an individual who's above the age of 50, they're feeling fatigue, we make sure they've not got polymyalgia. Once we have made sure that they have ruled out everything else, then the hope there is, like I mentioned, the MDT, we have got all the therapists, the physiotherapists, the OTs, the chronic fatigue syndrome, the support you, make you understand your symptoms, give you suffering in isolation. There are other people out there listening to other people's stories. And sometimes, again, in my 14 years of being a GP, what I have seen, once the mind knows what it or he or she is suffering from, all of a sudden mind sort of becomes a bit disinterested in that symptom. And that itself, I believe, is a very important message here. The symptoms are always worse when the mind is facing uncertainty. Once you've addressed that, the very likelihood I've seen a huge benefit in that. The final message which I would like to give to the people in Lincolnshire is that if you feel that you are suffering from long COVID symptoms, which is the general feeling of fatigue, you're feeling breathless, you've got headaches, which has been going on for more than 12 weeks after you've had COVID, speak to your GP. They have got a pathway. They will arrange some baseline investigations, perhaps a chest X-ray and an ECG, and ask them that could they refer you to the post-COVID clinic. Most GPs now are on board to this facility, and they will actively do so. So come and speak to us. We are here, like I said, to listen to you, to adhere, to understand you, and provide you with help and support so that we can make this journey a lot easier.